it's Yaz from Yorkshire Peaches Therapies, and welcome back to another episode of Hop, Skip and a Jump. Today I'm joined by Nina from Nina's Veterinary Physiotherapy, and we're carrying on the huge conversation that is hypermobility. Now, at the time of recording, this was pre-Nina's hypermobility event, but now I'm recording this section. This is actually post Nina's hypermobility event. And oh my days, that was one of the most insightful, enjoyable CPDs that I have ever done. So make sure that you check out Nina on her socials, and fingers crossed she will run this course again sometime early next year. But for now, I'm going to stop talking. Let's get back into that hypermobility conversation. Nina, I said I was going to have you back. We've just literally just rolled into the next podcast because we started tangenting as soon as we stopped recording. I was like, "Have you got a half hour spare? Let's carry on this conversation." So we were talking about medication and medication absorption. So in the last episode, we were saying that when you're hypermobile, it affects how we utilize certain drugs like opioids. And I can't remember how we started talking about it, but it was something to the effect that you were talking about gut absorption, I think.
Yes, so there's some research to say that medications can be absorbed at a different rate because of the gut absorption itself.
Mm-hmm.
So there's some research in humans where hypermobile people take longer to go under or need more anesthesia to go under, but they wake up sooner, and they think it's to do with absorption rates.
Mm-hmm.
But I don't know the ins and outs of it yet.
Yet, but again, like we potentially there isn't currently an answer to that question, especially when we're looking at our dogs. And the thing that we were discussing was if like a dog had TPLO, for example, is there a risk that these dogs are going to wake up earlier from their anesthetic? And anecdotally, I've also seen that dogs that are hypermobile struggle to come up to temperature
Yeah.
after anesthetic. I don't know why that is, but that's just what I've seen with my own dogs.
I know in hypermobile humans, there's a lot of temperature regulation issues. So you're either too hot or too cold, but you struggle to find that middle ground because your body struggles to actually regulate the temperature as it's supposed to be.
I wonder
So
why that is. It's just fascinating how
it's collagen.
collagen,
Yeah.
one component of us, when it's not behaving itself, can cause such massive impacts. I mean, speaking from personal experience, I know it's very difficult for doctor or anaesthetist to put me under. I just
Hmm.
sit there and look at them, and the nurses were all looking at me when I had surgery and like, do you not feel anything? I was like, no, am I supposed to be feeling something? So they have to give me a lot more. And it was the same when I had um, twilight sedation for dental work. It was like honestly trying to drug a horse. I was just sat there like it just wasn't working, and I don't know why that's the case, but can you imagine for our dogs if there's a set thing of okay, this breed needs to have this much. I don't know the ins and outs of that side of the.
No, even when I had brain surgery, after I came out, as soon as the anesthesia wore off, I was in horrible pain
Mm-hmm,
because the pain relief that was supposed to be working wasn't working because it was an opioid.
mm-hmm.
So what I'm worried about is if there's dogs that undergo surgery and then they come home and hopefully they have medication that's going to work. And luckily we don't just send dogs home with opioids.
Mm-hmm.
But it's the worry about immediately post-surgery. I don't know what they do with dogs, but I think it just, from a personal experience, I'm overly empathetic when it comes to that at the moment.
100%. I think usually I see dogs coming home with NSAIDs,
Mm-hmm.
which is a good thing. But if we look at opioid medication, and opioid medication is really good for nerve pain, what
Mm.
options do hypermobile people and dogs have if opioids don't work? Is there an option?
Gabapentin, I would say, because gabapentin's good for nerve pain as well, isn't it?
Yes, it is really good for nerve pain, and also I've read, I'm tangenting, for phantom limb pain.
Oh, I didn't know
In
that.
yeah, so phantom limb pain is another thing that I get really like into talking about. It's researched a lot in humans, so I think it's something crazy like 60% of amputees will have phantom limb pain. But yet, when
Crazy.
I try and have this conversation with vets, they're like, "Huh," like because it's just because you've got rid of the tissue that's the issue doesn't mean that the pain goes away. Now with humans, there's like cognitive behavioral therapy is really effective, and things like I think mirror therapy as well is really effective for phantom limb pain. But what about our dogs?
You're gonna have to go with the pain relief, aren't
You're
you?
going to have to go with the pain relief, but first we have to convince the vet that the dog has phantom limb pain. But for me, I'm like, shall we just assume they do? Because if we look at human research, and there's a big old portion of people that
Mm.
have that, and as well, like, what led up to that amputation? Was it a road traffic accident? Was it cancer? Was it a failed orthopedic surgery that's led to the amputation? If you've already got chronic pain in
Mm.
there already, you take away the limb, the nerves don't go, oh, thank goodness, I feel loads better. No, they're still firing like crazy. But anyway, I'll stop talking about that because we're talking about hypermobility. But yeah, phantom
No,
limb
it's a
pain.
fascinating subject.
I,
And I'm all for pain relief trials. So if you're
yes.
not sure, try it. And
Mm-hmm.
if it doesn't work, at least you know it doesn't work.
Yeah. I was lucky enough to speak to a chap who's an amputee, and he was a I was going to say four limb amputee. He doesn't walk on all fours. He's a man.
So,
Sorry if you're listening. So he has, I think, is he amputated from, I think, like the elbow, no, actually shoulder down is amputated, and that was following a motorbike accident. And I was saying to him, I was like, I've read really good things about gabapentin for phantom limb pain. He went, didn't touch me. He went, didn't work at all. And then we were talking a lot. I was like, explain the type of pain. And he said he gets like a crushing pain.
oh,
It was like, it feels like a crushing pain, or sometimes it's like a burning pain. But for me, we need to have these conversations. Like you say, you've gone and spoken to people who are hypermobile. I've gone and spoken to people who've had amputations, because that's the closest I think that we're going to get to understanding what a dog's pain experience is like. I always say to people, we're the same on a cellular level, we're just put together a bit differently.
no, completely agree with you. I think it's just we use the research we have, we use the experiences we have, we try and make educated guesses with the knowledge we have
Mm-hmm.
to help the dogs the best we can.
Yeah, I think
Which,
as well, like another thing, like, what's to say that bitches don't have endometriosis or polycystic ovary syndrome? I was speaking with a nurse, and she said a lot of the time when they do spays, there'll be cysts on the ovaries. And I went, what? I was like, do you know how painful ovarian cysts are? Like,
mm,
that's painful. It's really common in guinea pigs as well, ovarian cysts. And I was
oh,
like, do you tell the pet parents? She went, well, no, because we've spayed, so there's nothing really to tell them. And I was like, no, like that's really important information. So how many bitches are going through ovarian cysts and the pain associated with that,
mm.
and they don't ever
You know,
know.
when they say stay for behavior and then suddenly the behavior gets better, could some of that be pain related? Which
Yeah.
is a really interesting question.
Yes, and I adore talking about pain and pain behavior specifically. So I'll always, I don't profess to be a trainer or a behaviorist or anything like that. But if you've got a dog that's a really big resource guarder, I like to explain from a pain with the pain lens on. Okay, if you're
Mm,
painful and you say you've got lower back pain and you're leaning forward into that food bowl, you've had to work through pain to get to that resource, therefore increasing the value of that resource. Et voila, resource guarding.
mm.
Obviously, it's a lot more complicated than that. So
Yeah.
I can identify it, but that's why I work with some really great positive reinforcement, force-free, ethical dog trainers, because they can help with that bit, and I can help with the pain side of things. And I think it's important that we build a team of people
Absolutely.
around us, and you know, we've all got different expertise and we've all got different views on things from our own lived experience or cases that we've worked on. So again, I'm going to talk about your event. This is why I'm so excited to be in a room full of therapists who are just as excited to learn about this as, you know, as we are, you know. I think it's going to be meant.
I'm really excited. What I'm hoping from it is that we get so many more people who are looking out for it,
Mm-hmm.
and we get so many more experiences, more anecdotal evidence, more information that we can then use for the other patients as well,
Yeah.
because it's not well understood in dogs.
No, absolutely not. And especially with the medication side of things as well. Now, we were talking about gut absorption, and from a medication point of view, I do a lot of work in kind of like the nutrition realm, and I think, you know, when people say that we should be supplementing with collagen and things like that, I mean, yes, it's fantastic, but is it going to fix hypermobility?
Absolutely not, no.
No.
From what I've read, the only place where it's been shown to be effective is skin health. So what it does, it attracts water molecules, so it makes your skin look healthy and glowy.
Hmm.
It does nothing for your gut. It does not fix your collagen.
No.
You can eat as much collagen as you want, you're still going to be hypermobile.
Because it doesn't, you can't, well, there's no cure, is there? But for me, if I was to say to someone's dog who was, you know, hypermobile, I'd be like, I'd really be encouraging you to feed your dog bone broth,
Hmm.
predominantly for hydration, but also for the gut microbiome. The glucosamine and chondroitin content is not going to patch it's not going to patch your collagen fibers up, but I think it's an important conversation to have, because I know there's a lot of things on the market that people will reach for. Would you say that supplements is something that you talk a lot about as a therapist, or is it not something that falls into conversation much?
Thing is, it's such a controversial subject. There's
Mm.
so little evidence of what actually works.
Mm-hmm.
So I normally tell my owners, as long as you're on a joint supplement, if your dog has joint issues, I don't mind which one it is.
Yeah.
The only one that's been shown to be effective is omegas and green lip mussel.
Yes.
Otherwise, I don't mind as long as the dog's on something,
Yeah.
just in case.
Mm-hmm.
Because if it doesn't work, you're just losing money. And
Yeah.
if it does work, at least we get the best possible joint quality we can.
Yeah, absolutely. And I think when I talk about supplementing, it's about supplementing with purpose as well. I have a lot of people that'll ask, you know, should I be starting on joint supplements when they're young, as a to try and stop any joint degeneration? I'm like, I mean, it's not
It's
some.
a difficult one. What I did with my schnauzer, because the first day she came home, she ran into a door. I was like, okay, you're accident prone. I'm going to give you joint supplements
Oh
from the
my
get go.
days.
But in the end, I don't know if I'm making any difference. If it's not working, I'm losing money. If it's working, great.
Mm-hmm.
But I wouldn't tell all my owners to do that because there's no joint issues as such. She's just a
Accident.
little bit accident prone.
Just an accident prone dog. I think for me, if if the funds allow it, like, you know, say if you wanted to supplement with a good quality omega 3, or omega fatty acids, so you need your 3 and your 6, but I would say yes, because it's not just joint health that it's good for. It's good for skin health. It's good for gut health. It's just a good all rounder. Um,
Yeah.
would I be putting a puppy on really expensive U move that didn't have any joint issues? No, because I think there's other way. Like, look at that ingredients panel and go, okay, what's in there? Glucosamine and chondroitin. Okay, you can get a bit of that from bone broth or feeding like chicken feet and things like that. But I wouldn't be going out of your way unless you have something like diagnosed. But I know some people like to kind of preemptively do it, but whether or not it has protective effects, I'm not sure. We don't
No.
know. We don't know.
It's one of those things. If you have the funds and you want to do it for your peace of mind, go for it.
Hmm.
But if you don't want to, I'm not going to tell you to do it.
Yeah,
Like,
because
it's one of those things.
I think as well, like with there's ways that we can supplement the diet with like eggshell membrane. Eggshell membrane has
Mm.
really, has some research behind it to show that it improves joint range of motion. And if you're making scrambled eggs, just peel the shell out. I mean, the shell itself is a really nice bioavailable source of calcium anyway. And if it was going to go in the
Mm.
bin or the compost heap and the dog's happy to eat it, I've got two dogs that like eating them and crunching them up all over my carpet for me to hoover. But if it's
Might as well.
that's might as well, yeah, chuck it in. And then with your anti, so when I'm talking about supplementing for joints, I talk about a nice anti-inflammatory. Chamomile tea is one of the easiest things that you can source. You can pick it up from the supermarket. It's nice for your dog. Make sure it goes tepid. Check it on the inside of your wrist before your dog drinks it. Nice anti-inflammatory. Peppermint tea is a good shout as well for dogs that have got digestive upset. Glucosamine and chondroitin from your bone broth, and then a nice omega as well. So that could be anything from antanol, which is your green lip mussel, and they have some good research behind them as well, all the way down to just adding some fish into the diet. It doesn't
Yeah.
have to. It doesn't have to be mega expensive. And I don't actually know how we got onto this tangent about supplements. Why was I talking?
Collagen for hypermobility does not work.
There we go. That's where I went with that. Sorry. I tangent so badly. So,
Mm.
can you think? Well, we'll go back to the hypermobility talk again.
Yeah.
So, can you think of a case where you've had success with treating while working and managing that hypermobility?
I think there's a spaniel I'm working with, and I am so proud of the dog and the owner. It was one that came to me because they had really strange cramping on some walks, but not all of them. She was absolutely fine, but there was something off.
Mm-hmm.
Hypermobile. She was having to brace herself in those walks, causing a whole lot of muscle issues, overworking the muscles, cramping.
Mm-hmm.
So she can stand still, makes me so happy. She is so strong from what she was 6 months ago.
Incredible.
And I think if we can keep her as strong as we can, she can still compete, she can still work, she can be a normal dog,
Mm-hmm.
but she's moving so much better. She's so much stronger and hopefully less accident prone now. Because,
Fingers crossed.
spaniels.
Spaniels, 100 miles per hour. Now, we were talking about the types of dogs that we treat. So,
Hmm.
Spaniels and Labradors, very, very popular in this country.
Hmm.
But we were talking about dogs that have that excess skin. So, Shar-Peis and Neapolitan Mastiffs and Basset Hounds and
Hmm.
Bloodhounds. And understanding whether it is a case that they are bred to have excess skin or whether or not it's a collagen based issue.
Because excess skin might not be stretchy, so you're looking for the stretchy skin versus the excessive skin,
Mm-hmm.
which is when we're looking for hypermobility, we do want to check for skin elasticity, but we also want to make sure the joints are actually hypermobile.
Mm-hmm.
But it'd be fascinating to get hands on like 1,000 Shar-Peis and have a look how many of them are actually hypermobile and how many are not. Like
I
it
mean,
wouldn't.
yeah, if anyone could organise 1,000 Shar-Peis to all be calm, collected, and we could assess each one of them, that'd be great. If someone could just drop me an email, that'd be awesome. But as well, when I go to Crufts, which I know is a bit ooh, but I go there to educate about canine pain and also look at the gait of dogs that I don't see a lot of.
Mhm.
Chow chows. I think a lot of chow chows are hypermobile.
I'd be fascinated to get hands on, wouldn't it?
It would
See,
be
I don't
fast,
see
but
that
we
as
no.
physio,
I don't.
which
I don't see chow chows. I've seen one Shar-Pei. I've got one Mastiff. I've got a lot of Golden Retrievers and Spaniels and Staffies. It's now Staffies.
mm,
They're an interesting one because I. It's really difficult. I don't see a lot of the skin elasticity in the Staffies.
mm,
But I see a lot of the struggles with hyper arousal. But
mhm,
it might be a daft question, but with the staffies, because of the muscle fiber types, they're built to be stacked,
mm,
aren't they? Do you
yeah.
think that might hide that skin elasticity because they're so built underneath?
It could a little bit,
Mm,
but if you're still checking the knee and the shoulder,
mm-hmm,
you should be able to get a true reflection of is it actually a hypermobile dog or not.
mm-hmm,
Even if it's a really built up hench little dude,
mm-hmm,
you're still going to be able to look at how much abduction you have on that shoulder angle. You're still going to be able to see how far does the knee actually stretch.
mm-hmm,
So if you're unsure about a skin elasticity, don't stress, check the other ones.
mm-hmm. Because with staffies or bull, well, yeah, predominantly staffies, staffy crosses, I see a lot of luxating patella, low grade luxating patella, but it's there,
Mhm.
and I'm thinking, is this because of the angulation or lack of angulation in the hind limbs, or is it secondary to hip pathology that is changed because they're like right narrow in the, so they're so broad at the front, but then they have like these narrow, this narrow pelvis, and then that secondary makes the hind limbs very medial.
If you think about their center of gravity as well, the whole gait is so different.
Mm-hmm.
And if you think about patella luxation, you need a strong quadriceps muscle because if the quadriceps is not strong, the actual patella tendon is not going to stay in its groove as well.
Mm-hmm.
So if you have a little dog with really straight legs with a really weird straight center of gravity, it's not going to be picking up its feed the same way.
Mm-hmm.
So it could be that you have a combination of things to create more of a perfect opportunity for the kneecap to come out, or imperfect opportunity.
Imperfect opportunity. So, with your hypermobile dogs that come to see you, how do you, are they getting referred to you for hypermobility, or are you finding it and then sending them back to the vet? So they come in mainly for other things first.
They're coming for other things. So majority are either for behavior issues
Mm.
where scans don't reveal what's going on,
Mm-hmm.
or the owners have noticed something's off with the gate, but they can't pinpoint what it is.
Okay.
Or it's a case that has a lot of stuff going on, and then we find that in addition to everything else, we also have the hypermobility going on. So it's normally ones that don't come as diagnosed hypermobile,
Mm-hmm.
but then we send them back to the vet saying we think there might be some hypermobility.
Mm-hmm. God, it's just so interesting. It's, I'm looking
Mm.
at all the dogs that I've got that come to see me, and I'm like, there's so many hypermobile dogs there. But I always, do you find the conversation a little bit difficult to have with vets sometimes? Because for me, sometimes I'm struggling to get a vet to get on board with the fact the dog's painful. That's like the first
Yeah.
hurdle. And then the second hurdle is please, 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 can we have some imaging because I think there's a pathology here. So that's the second hurdle. And then I always feel like, oh, I know we've found hip dysplasia, but I think there's something else, and this is why I think there might be something else. So it's like, for me, hypermobility isn't the first thing that I'm trying to address. Usually, I go, right, okay, let's tackle the pain, then let's tackle, see if there is pain there.
Mhm.
Then we get a diagnosis of something that's potentially more recognised before we then go on to that third prong attack. Would you say you do something similar, or?
I think what I tend to do is if I see a dog that I think could be hypermobile, I tend to bullet point all of my warning signs to make it really easy for the vets to see this is why I'm concerned.
Mm-hmm.
And if there is a suspicion that there is pain, I do the same. So I bullet point it all and saying this is why I think the dog would benefit from pain relief.
Nice.
So it kind of makes it as easy as possible for the vet to see this is why I'm concerned.
Mm-hmm.
This is why I would love for the dog to be on pain relief.
Yeah.
And then I put a paragraph at the bottom saying, I think there is a hypermobility aspect, but then leave it with the vets for the diagnosis because that's way out of my remit.
Yeah, that's out of our remit to be diagnosing. So we mentioned on the last episode of the podcast that you have an event coming up about hypermobility. Now, for any therapists that are listening now, what are going to be, that's terrible English, what are three key things that they're going to be able to take away from this event?
I think just knowing what a hypermobile dog looks like.
Mm-hmm.
I have loads of gait videos so you can see the variants in it.
Mm-hmm.
Knowing what the main red flag symptoms are, and there's quite a few of them.
Mm-hmm.
Knowing how to check, and then if you put a rehab plan in place, what are the main things you have to hit? Sorry, that was 4 things.
No, that's fine. I'll take it.
Yeah.
Nina, I am so excited for your event, and I think it's just going to be amazing to upskill a group of therapists. Now, if people want to find you on social media or your website, where can they find you?
Facebook, Nina's Veterinary Physiotherapy, Instagram at Nina's Vet Physio, and I'm not so cool for the other socials, so those two will do.
Perfect. Well, Nina, thank you so much for your time today.
Pleasure.
Thank you. So, if you have enjoyed this podcast, please make sure to like, share, and subscribe. Make sure you check out Nina's event all about hypermobility, and also check out Nina on socials. For now, lots of love to you and your dogs, and I'll speak to you soon. Take care. Bye.